A woman's right to choose the number, timing and spacing of her children is fundamental, and contraception is an integral part of her decision-making. Contraceptives have a proven track record of enhancing the health of women and children, preventing unwanted pregnancy and reducing the need for abortion. What are the available contraceptive methods? Join us for answers as we shine our spotlight on contraception with the objective of raising awareness on this very important intervention to enable people make informed choices about their sexual and reproductive health. Thanks for joining us on this episode of Health Options. I am Rabi Abdullah. Welcome back. If you're just joining us, this is Health Options, the program that not only tracks government policies on health, but gives you the right information you need to make informed choices about your health. And our focus is contraception. With me to take us through the topic is Dr. Salma Anas, Director of Family Health Department, Federal Ministry of Health. Glad to have you with us, Doc.
Thank you very much, Rabi.
Let's start on a general note now. Contraception. What is the place of contraception in reproductive health?
It's an integral part of the reproductive package. In fact, we say this whole scope of the family life cycle, the reproductive, maternal, newborn, adolescent, and child health, because it has one impact or the other on the whole life cycle of an individual. So as a woman, so looking at it within the scope, even as a girl child, as an adult, adolescent, and also as a girl, there's a time that you will definitely need to control and manage your fertility. Because not only for the positive impact on you as an individual, your health, but also the health of your children that you are bringing to the world, and also the impact on the community and the overall positive impact on socio-economic development.
I think the whole thing around it basically has to do with preventing unwanted pregnancy. Yeah. It means you need to be ready.
Yes.
Right? So that gets me thinking. What about young adolescents?
So contraception is for everyone. Everyone that is in need of preventing pregnancy, especially what we call the unwanted pregnancies, pregnancies that are not planned, whether within marriage or outside marriage. So it's for the whole of every woman that is within the reproductive age. But we do know that significant proportion of our married women of reproductive age also are constituted by the adolescent girls. So there should be free access, to information in the first place of the type of contraception you will need for your type, for your style, and that will meet your needs. And also there is need for the commodities to be available and accessible, quality, accessible, and also affordable.
Okay.
And in most cases, it must be free, and this is what the Nigerian government is doing, because most of these women are vulnerable women, especially the adolescent girls. They may not be able to afford it, and there are barriers within communities also that deter them from accessing quality services. So government of Nigeria has made it free in the public health facilities so that women can have access to it also.
What constitutes contraception?
So thank you, Rabi. If I might go back, I say, what is even contraception?
Exactly.
Exactly. We need to know from there. Yeah. So as we say, contraception is anything that we use to prevent pregnancy, especially unplanned pregnancy. So be it a woman or a man on both sides, you can take measures, deliberate measures to prevent pregnancy. And you have to use what we call the contraceptive products. So these are products that are readily available. And there are also non-products, natural way of doing it. So we're looking at the natural way, the products that you can have access. There are products that could be in form of oral pills. They could be in form of injectables. They could be in form of what we call intrauterine devices, either hormonal or non-hormonal. And they could also be in terms of, you can use like a diaphragm to cover the cervix so that it does not have access to the sperm to produce. And then you can also use like the condoms. So there are several different methods that can suit individual. And there are also the natural methods, you know, that they are not product. And this can also be on both sides of the male and the female. So on the side of the woman, she can decide also to use the timing of her menstrual cycle to determine the timing of her ovulation period. Exactly, every month. So she charts it and then record it, because temperatures fluctuate. She needs to know the right temperature, and with time she will get to know the right temperature that she's ovulating. So these are another way that you can use the calendar, the menstrual cycle, and also the secretion of the cervical also changes. So these are natural methods, even though their efficacy is not as effective as the use of products.
So the ovulation period means she has to stay off sexual activity.
Away totally from sexual activity.
In order not to
or
become
if she
pregnant.
she has to use the condom, you know, at another product again. And then on the side of the men also, they use what they call withdrawal methods, which means they don't ejaculate inside the woman, they have to withdraw and ejaculate outside. So these are all natural methods. And then outside that also, there are methods. The ones I mentioned are temporary reversible methods. So the time that you decide to go back to your fertility, you stop. Then there are permanent methods where you decide forever you don't want to. You want to avoid pregnancy. So these ones are also available methods for women that have had adequate number of children and they don't want to go into that business of reproduction again. So options are available to them and also to men. And these are what we call the sterilization. So for women, it's usually the tubal ligation. You know, you cut the tubes or you tie the tubes so that the eggs does not flow or the sperm does not flow and meet the egg. So these are permanent methods. So some can do it for reasons best known to them, medical indication. Maybe the woman has certain illnesses that she's been advised not to go into a pregnancy again because of her physiology, or some because you have reached the number of children that you want to have. Because without contraception, without intervention, a woman is likely to produce, even if you have 2 years intervention in your life cycle, you can produce more than 30 children without family planning. And then the body the system that you have cannot cope with that mechanism of production of children. So that is why it becomes critical and a way of life of the family to be able to adopt and look at what options fits them most and the best.
Okay, for the natural method, did you mention breastfeeding?
So yes, thank you for bringing that up. Very important because it's another natural way, and most women use the breastfeeding.
My favorite.
Yes, which we call the lactational amenorrhea. So some women, most women also, significantly when they breastfeed, you know, we said breastfeed exclusively and continue up to 2 years. So throughout the period of their breastfeeding, they don't their menstrual cycle does not resume, and if they are lucky also their ovulation does not resume. So that is another form of natural family planning, and a lot of women do it. It is also effective, but also there are very high failure rate because some ovulation resume without the woman even knowing. But in most women, the lactational amenorrhea is another option because as long as she continues to breastfeed, the hormone like the progesterone continue to suppress, you know, a menstrual cycle, as well as in some cases the ovulation. Okay. So these are all natural methods that women have. We also have new products now in the market. You know, so this is what we call the family planning commodities mix. So we have different choices for women and men in the family planning program. The mix also now we have hormonal intrauterine device. These are hormonal device that you can use, and then they have very less side effects, and they can stay for like 3 to 6 years. And then the no plant where you can have like sticks in the upper arm, and then it can also stay like for 5 to 6 years without returning to fertility, and then you can reverse it when you want. Another mixed method that are available also, which is very effective, especially for women that needs to be empowered so that they have control of their fertility. These are available in the market where you self-administer, just like we self-administer insulin by diabetic patients that are insulin dependent. You know, those that are insulin, we are used to it in Nigeria. They inject it anytime and they manage their diabetes status. So this is similar to it, and we call it the dexamethasone acetate, self-subcute. So the DMPCSCA subcute, a woman just injected self-administration under the skin.
What part of the body?
She can administer in the upper and on the thigh at any time, just like you administer the insulin. So you see, it doesn't, she has control over it. She doesn't need to go to the health facility. Once the health worker train her on how to do it, she'll continue to administer it, and it can take a very long time.
What's responsible, you know, in terms of some misconception, you know, regarding the long-term, you know, effects of, you know, contraception?
Yeah, so there are lots of misconceptions, there are lots of myths around fertility control, you know, and management. But the efforts that we are putting in, and this is exactly what is tagged this year as the World Breastfeeding Day, is to also create that awareness. Just like what we are observing this year, 26th of September every year is dedicated to observe the World Contraceptive Day. And the purpose is to create awareness, because awareness has been a key area that we are still lagging behind in terms of uptake. Nigeria, we are not where we want to be, but we have made modest progress in the recent years. Since the introduction of the National Family Planning Program by the federal government of Nigeria and the Ministry of Health in the early 80s, it was very, very low. Today, our contraceptive, the MCR, that is the modern contraceptive prevalence rate, has continued to grow. In fact, the growth rate is almost at about 3% and above, which shows that we are really making modest progress, even though very slow. If you look at the National Demographic Health Survey that was conducted in 2013 and compared to 2018, you will see there is a modest progress. As of 2018, the modern contraceptive prevalence is about 12%, and the total contraceptive, that is taken all together, including all methods, it's almost at 17%. And recently, from recent surveys, we are beginning to see another increase in the contraceptive, almost by about 3% additional to the 12% or 5%. So it's almost at about 17%, and those plus, and also the total is almost 21%. So that shows increment, and that also affects the total fertility in the country. In 2013, it was 5.7%. Then by 2018, the total fertility came down to about 5.3%. And now we are glad to mention also, though we are still planning for the National Demographic Health Survey, but there are other international surveys that are acceptable and endorsed in Nigeria.
So what are they telling us?
And they are now telling us that it has even declined to about 4.6%. So which means the uptake of contraception is gradually growing, and it's growing up, and the growth rate is even up to 3%, just like our population growth rate is 3%. So this is really amazing. And you know, another big booster and a catalyst, you know, was the launch by the president himself of the National Population Policy, which is a policy on the management of our population for sustainable development. So that has also boosted, because it has also, he has made commitments, and Nigerians have also made commitment, and we are part of the global commitment on family planning, which is called the 2030 Vision. And the idea is for Nigeria to move from this level to improve our family planning uptake to 27% by 2030, and even beyond. And I'm glad and optimistic to note that the way we are growing, it appears Nigeria is going to achieve 27% by 2030.
Okay, so
if today we are saying we are almost around 21% plus.
How would a woman know what is best for, what method is best for her to adopt?
So these are part of the myths that we are dealing with in the health sector, because what we advise women and men as well is that you should know yourself better. What applies to another woman does not apply to you, because you are totally different. And there are various options that you need to look and take your choice based on your own circumstances. There are women that will take oral contraceptive every day of their lives. For some women, it's not possible because of their nature and makeup. There are women that will prefer to go to injectables just for 3 months. There are women that don't even like injections. It's a nightmare for them to ask them to go for injection. So it's a barrier. So there are options. And so we don't say what goes for this particular woman A also applies for B. And this is where the counseling comes in. Our health workers are well trained on counseling skills. And this is where they sit one-on-one with a client, and that is the woman or couples, and advise them and provide all the options and understand also their physiology, you know, their socioeconomic status, you know, their level of education, because all matters. Then it helps them to decide what is the best choice for them. Even the self-administration, where I say not every woman will be able to administer self-injection, but other women is the best option. Some will go for the no plant, where they put the sticks like about 4 or 5, and off they go for another 5 to 6 years and focus on their livelihoods and activities. So we are aggressively enlightening the communities. We're enlightening the families, and then we are involving a wide range of stakeholders in the community leaders, religious leaders.
Religious leaders. I was going to ask that because I've attended a lot of fora where such issues had come up. You know, we know some faiths don't even you know, accept that.
We work together, we partner with Islamic religious leaders and also the Christian religious leaders on what does the two religions see. And there are different perspectives. Within Christianity, there are different perspectives. So based on their own affiliation and thinking, we work with them and look at it, what works. And some will tell you that for health benefits, you know, to improve the health of the woman, we can adopt breastfeeding, and also to space the children, because you can't have a woman having children every year or every 2 years. It becomes a burden. So it affects also the health of the child, you know, the nutrition of the child, leading to malnutrition, leading to deaths, high infant mortality, and also morbidities, that is sickness. The same thing also applies to the mother, plus other siblings. So when we dialogue with them on their own, they come up with a direction on what best fits into their religious thinking. You know, in Islam, it's there is quotations in the Quran that talks even about breastfeeding up to 2 years. And so you see, family planning is always naturally integrated in it. And then there are a lot of sheikhs and ulamas that have also talked about the use of family planning to improve the health of the mother, to space the children, healthy timing and spacing of pregnancy, and also to improve the well-being of the mother. So one cannot just say one, but I'm glad to mention we've worked with different associations and organizations of the faith base, one of which is the Interfaith, to promote family planning awareness and demand creations. We've engaged with several religious leaders also that are currently promoting. But of course, Rabi, we need to do more. You know, we need to do more, because family planning, child spacing is not a new thing. It has been there traditionally. Like in some Muslim ulamas will tell you, the withdrawal, it has always been there since the time of the Prophet ﷺ. He has promoted the withdrawal. And some of them will tell you that the Prophet has also promoted that you should have the number of children that you can take care of, in terms of not just nutrition, but also moral upbringing. So you see, a lot of them are beginning to have a better understanding. But one of the key misconceptions is that a lot of religions here, they feel it's a foreign agenda. It is not. It is our own agenda, and it has been there even before the step up of family planning, which started just about 60 decades ago. The family planning commodities, but people have traditionally been using family planning methods exactly, which has not been so effective. So you know, the world is dynamic, and medicine is the same thing, and science is the same. So it keeps on evolving and coming up with better way of doing things. So today, and research is still ongoing on how do we make family planning products much easier to administer, more acceptable to both women and men. And Nigerian government started providing family planning free since 2011-2012. The federal government of Nigeria started allocating resources for the procurement of family planning through what we call the basket funding. So other donors support us in the basket funding, and Nigeria continued to commit to that up till today. So now what we are seeing with the impact of the COVID pandemic, which has also affected every aspect of our development, including delivery of quality access to family planning commodities, We are now promoting this, more of domestic financing to secure procurement of family planning and delivery of the services. So currently we are promoting state governments at the subnational level to take responsibility. And I'm very happy to say about 10 states in Nigeria have shown that commitment. They've already dedicated funding for procurement of family planning commodities for their citizens in the state. So this is, I think, it's a progress for Nigeria, and it's part of also the achievements of this administration, you know, taking it to the subnational level and having that ownership so that we can meet also the global commitment. Because that is the only way, as I always say, you know, this year's theme, it talks about history, where are we coming from? It also talks about, you know, the significance, why are we doing it? And costs, and also some lessons learned to improve awareness. So I'm glad to say Nigeria, we have a lot to show in the last decade, what has happened, especially in the last 4 to 5 years. Despite the COVID pandemic, the dwindling resources, we have sustained commitment to the procurement of family planning. We've even had additional commitment from the subnational government for procurement of family planning through the basket funding, which is being anchored by UNFPA to ensure neutrality. And they also have, because they do it globally for different countries, they also are able to have a subsidized, you know, pricing to procure for Nigeria.
So what would you like to say to those other states that are yet to do that?
So what we want to say, they should key in to the project, to the program, and ensure that, because that is the way, it's a key game changer in the saving of lives of women and children, and also national development completely, because there is no way you can have attain universal healthcare coverage, which is what we want to attain in Nigeria, without integrating access to family planning as an integral part of your sexual and reproductive health commodities. And I encourage subnational government that are not doing so. It is like you guaranteed by doing that 30% life saving, because 30% of women that are properly, you know, using family planning commodities, it's like you have saved 30% of them. Because once someone is not exposed to pregnancies, I mean, it's almost 0% her chances of dying from pregnancy-related causes and childbirth. So that is a guarantee, and it's a quick win. So you will deal with other issues. And we know scientifically, evidence have shown us from our daily work that exposure to pregnancy is more than 30% cause of death in women. 40% of our adolescent girls that die as a result of pregnancy and childbirth.
On a final note, some people have said contraception kinds of, you know, encourages promiscuity among young adolescents, unmarried girls, school girls, and all of that. What would you say? What's your reaction to that?
There is nothing, my Rabi and the audience that are listening to us, that will come, and then even immunization, that will not have its own side effects or overblown. But I always say, let us do a cost-benefit analysis of whatever intervention we are doing. What is the benefit versus the non-benefits to the general population? And I can comfortably say that the benefit of use of contraception is far outweighs the benefits of non-use, because most women and girls and adolescents will only use contraceptive when they need to prevent pregnancies. The consequences of unwanted pregnancy far outweighs the consequences of not having access to contraceptive. Because one, if a girl is in school, it has destroyed her education and her career in the future. And then the complications of even the deliveries that will be associated with it. And then the implications of having a child that you did not plan for far outweighs not using for contraceptive. So these are areas that are, you know, very dicey still in our communities, especially by community leaders and religious. So what we continue to do is to advocate, to create awareness, let them have a better understanding of situation, of how can we collectively work together to save lives. Okay, that is the most important.
Yeah, it's about saving lives, and we should not leave any stone unturned when it comes to contraception. It's about the health of our women and children. children. On that note, I would like to say thank you to you, Dr. Salma, for making our time to join us on this episode of Health Options.
Thank you very much.
This is where we end this episode of Health Options. A quick reminder that you can go to our YouTube channel to watch the upload of this and other episodes of the program. Email us for your comments and contributions at healthoptions@nta.gov.ng. I am Rabi Abdullah. Thanks for watching. I do hope to see you again.